Hello, I'm here today with Dr. Ariel Pablos-Mendez. He's the Assistant Administrator for Global Health at USAID, and I believe that makes you the most senior figure at USAID who concentrates day-to-day on global health issues, correct?
That's correct, Jim.
And I want to ask you, we're here at a conference on universal health coverage. What has been the U.S. role in universal health coverage? Can you give us some background?
Clearly, USAID shares the aspiration to see all people have access to appropriate services without undue financial burdens. And our commitment in the over 50 years had been to help support that cause around the world. Universal health coverage is the aspiration of every health system and of every health professional. And so as such, our work in global health, supporting the poor in the poorest countries, contributes to that long-term aspiration. But as development is succeeding, USAID has also been supporting the health systems as they transition from providing services in the poorest services to strengthening the capacities of countries to steer their own health systems towards universal health coverage.
So this has been a long-term initiative or a priority for the United States. But please tell me, after the outbreak of Ebola, how has the U.S. focus on this changed?
Well, clearly, Ebola has revealed for many, and really you have seen many calls for the importance of strengthening health systems. Universal health coverage is the true north that organizes health systems towards. And Ebola showed that health systems were not strong in West Africa. How do we work to strengthen health systems is now a question that is resonating everywhere, from Washington to Germany to Tokyo. And I think that the discussion is now, how do we do that well? USAID has for many years built the actual pillars of health systems, working on human resources, on governance and stewardship, on financing, on information systems, on supply chains, on service provision at the community level. So all of these are the pieces, but we need to invest a lot more. Oftentimes we have to invest on fighting specific diseases that burden systems, but also are a priority and emergency and so on. But I think the lesson of Ebola is that we must invest in strengthening health systems as a whole, because you never know when the next hit will come, whether it will be Ebola or another outbreak or some other type of challenge. So resilient health systems is at the core of societies being able to withstand any of many challenges.
And by investment, are you speaking about a financial investment, or is this a broader?
Oh yes, well, USAID had already established an Office for Health Systems that is now focusing across the many elements of funding that we have in the U.S. government portfolio to do that exactly, to strengthen system. And following Ebola, I was so impressed. I was proud, of course, of the response of the U.S. government all the way to President Obama, and the Congress also support for that response has been unprecedented. In that response included not only dollars to end the epidemic, which is now ending in West Africa, but also the investments. Everybody has supported the investments to rebuild back and better resilient health systems in West Africa.
Well, thank you very much for sharing that with us.
Thank you, Jim.